Welcome to our channel. Today, we are going to learn how to ask about side effects of a medication.
That is such an important topic, Emma. I always freeze up at the pharmacy because I'm scared I'm going to sound silly asking too many questions.
It's never silly to be safe, Mark. Knowing the right vocabulary helps you advocate for your health. Today, we'll master the terms so you can ask with confidence. First, we need to distinguish between two key terms. A side effect is a secondary effect of a drug, often expected and usually mild.
Okay, so like getting a dry mouth?
Exactly. But an adverse reaction is an unexpected, dangerous reaction to a drug.
I see. So side effects are annoying, but an adverse reaction could be harmful.
Are there any common side effects I should know about?
Are there any common side effects I should know about? That feels natural.
Yes, it opens the door for them to explain the basics without you needing to know specific medical terms yet.
What about driving? I drive to work every day, so I need to know if a pill will make me sleepy.
Great point. You should ask, will this medication cause drowsiness?
Drowsiness. That's the fancy word for feeling sleepy, right?
Precisely. Many allergy medicines or painkillers list drowsiness as a major warning. The worst feeling. So I ask, will this cause nausea? Yes. Or you might ask, should I take this with food to avoid nausea?
That's a pro tip. Taking pills on an empty stomach is usually a bad idea for me.
Sometimes the reaction is visible on your skin. You need to watch out for a rash.
A rash is like red spots or itchy skin, right?
Correct. You can ask, is it possible to develop a rash from this antibiotics course?
Nobody wants to walk around itchy. Good word to know.
All right, Mark, let's role play. You're the patient, I'm the pharmacist. You are worried about your balance.
Okay, deep breath. Here I go. Excuse me, I'm starting this new blood pressure medicine. Is there a chance it will cause dizziness?
It is a possibility, especially when you stand up quickly. If you feel lightheaded, sit down immediately.
Good to know. I'll be careful.
Now, this is serious. If you can't breathe or your face swells, that is an emergency. You need to ask, what should I do if I experience an allergic reaction?
That sounds scary. An allergic reaction can be life-threatening.
It can. Knowing the plan, like stopping the drug or calling 911, is vital. Sometimes medications affect your senses. A common term is blurred vision.
Like when everything goes out of focus?
Exactly. If you ask, is blurred vision a potential side effect? You'll know not to drive if your eyes feel funny.
Definitely essential for safety.
Emma, sometimes the list of side effects is a mile long. It freaks me out.
I get that. That's why you should ask about frequency. Try, how common are these reactions?
How common are these reactions? That helps me distinguish between a 1% chance and a 50% chance.
It's not just about the pill itself, but what you mix it with. These are called interactions.
Oh, like drinking alcohol with antibiotics?
Exactly. Ask, are there any known interactions with food, alcohol, or other drugs?
I once heard grapefruit juice can cause interactions with some heart meds. Crazy, right?
Once you start taking the medicine, you might feel something weird. You need to verify if it's okay.
So I could ask, is it normal to feel a bit lightheaded?
Perfect. Is it normal is a great phrase to check if your experience is expected or dangerous. Let's do a phone call role play. You took a pill an hour ago and your head hurts.
Got it. I'm calling the clinic. Hi, I just took my first dose and I have a mild headache. Is this a normal side effect?
Yes, a mild headache is common as your body adjusts. However, if it gets severe, call us back.
Okay, thank you for the reassurance.
Do side effects last forever?
Usually not. That's why we distinguish between short-term and long-term effects.
So I can ask, are there any long-term effects I should worry about?
Yes, especially for medications you take for years. It's smart planning. Finally, let's talk about tone. Doctors are busy, but you deserve answers. Start gently with, I'm a bit concerned about.
I'm a bit concerned about the side effects. That sounds polite but serious.
Exactly. It shows respect, but signals that you need reassurance. You've learned so much today. Let's recap the top 5 phrases.
1. Will this cause drowsiness?
2. Ask about common side effects versus adverse reactions.
3. Watch out for rashes or nausea.
4. Check for interactions with food or alcohol.
And always ask what to do in case of an allergic reaction.